We're having authentic conversations with business owners, pharmacists, now founder. This is More Than a Woman podcast. I'm Genavieve, Paige, and we have Meyer Davidoff.
You said it right.
Yes, we have him here today to tell us a little bit about who he is, his companies, and what he's accomplished. So thank you so much for coming on to the show today. And just to start off, I want you to tell everybody who you are and how you've gotten here and what you're doing today.
Well, thank you for having me, Genevieve.
Yes.
It's a pleasure. My name is Meyer Davidoff. I co-founded Invictus Pharmacy. We're a nationwide licensed digital pharmacy that serviced over 1 million people in the last 7 years. And we have a little bit of an edge compared to your typical pharmacy is that we provide direct savings to customers. So whether you're insured or if you're underinsured or you have no insurance, you're able to now go to our website and shop for prescription drugs that typically would cost thousands of dollars. And you can get them for a fraction through our website. And the way we're doing this is through partnering with drug manufacturers, which haven't been something that hasn't been done before in our industry. So we are pretty much direct to consumer. We have an online pharmacy that's licensed in all states, and you're able to get your drugs at a fractional cost compared to, let's say, 5-10 years ago.
Did you start this company with the intention of making money, or were you angry with the system?
Truthfully, I started this company just to pay my tuition bills.
Okay.
I'm a kid of immigrant parents. I pretty much had to hustle my way out through high school, through middle school. And the idea was never to start something big. It was just to sort of figure out a way just to sort of put food on the table and cover just necessary expenses. And just one thing led to another in my life. And I was just fortunate to have right guidance and the right mentors that led me to the pharmacy industry. And what was first something that I think my parents were pushing me. I have Jewish parents, so it was always about doctor. You got to be a doctor. I always pushed back on that because I didn't want to be in school for that long. Mm-hmm. And I found that pharmacy was sort of that right medium where it combines business aspects with commerce and there's healthcare aspects to it. You also get a doctor or a pharmacy, so that was a check mark for my parents.
It's so funny that you say that because I wanted to be a doctor, but I also knew that I didn't want to be in school for that long, so I didn't end up pursuing that. And now I'm in a completely different industry. So I love that you were able to find what you love, but then, I love
that medium.
Right. Find the happy medium.
That's
so
right.
At what point did you realize that the healthcare industry was doing a disservice to the consumer?
Since day one. I mean, it's not intentional. I think it's just one huge system. And because everybody's sort of looking out for their own interests and their own sort of bottom lines, the system is broken. It's been broken. And you can see that costs keep going up, prices keep going up, but the quality of care is going down. And the problem is that we're in this huge healthcare system where mega companies, huge conglomerate companies, mm-hmm. run your health, my health. And that doesn't allow us much choice in terms of how we're getting treated, what is the right treatment option. And we end up just sort of being almost like a little or like little rices in a bag where we have pretty much no control over our health or our decisions.
So you started this company, you said, just to pay your college tuition. How old were you when you started?
So I actually opened up my first pharmacy. I was able to sort of gather all my bar mitzvah money, all my money that I got from my odd jobs. I was probably 24.
Okay.
In my last year of pharmacy school. And I was fortunate to have a good friend and also a classmate of mine, Alan, and him and I decided to open up this one brick and mortar pharmacy in North Jersey, originally from Queens myself, but we had an opportunity. We saw it. It was a great spot. And, it's something that's sort of like a normal, typical business. We would have a grand opening. We would have, knock on doors, visit doctors, introduce ourselves. But we knew that there was something different that we needed to do to sort of stand out. And it was before COVID. What led to us was our first opportunity was basically doing these genetic tests for patients. And there's beauty behind it where we would partner up with a laboratory, swab the patient or collect their DNA sample through saliva, send it to a laboratory, and then the laboratory would give us a report on how that patient is able to digest and metabolize every drug that's basically approved. And that was sort of the dawn of like personalized medicine right there. And we thought to ourselves, we found something that typically would not be done in any pharmacy. It was a very unique niche, and that got us sort of going. And we realized that that's the way to healthcare. The way to healthcare is personalization. It's personal attention. What is right for you may not be right for me, and so on.
I feel like that's extremely important and people will appreciate that kind of research. And I had never even heard of that. So that's amazing work. Are you still in business with this business partner?
So we are still doing this. It's called pharmacogenomic testing. It's called, or PGX for short. And tests are they're pretty simple. It's a saliva swab. You could just send it in the same way you would send it for your like ancestry.com or I think it's
Can they
23andMe.
only find it in that brick and mortar or is it something that people have access
Oh,
to?
you could get these tests now from your providers, from doctors, from any primary care physician could actually administer this kind of test for you. So it's not exclusive to us, but it's a great thing for any individual to really know their I guess genetic makeup and how their body reacts to over I think 200 drugs out there.
Of course. So you've seen patients at their most vulnerable.
Yeah.
What's one moment that changed the way you see healthcare?
So, so I don't practice I'm not a pharmacist anymore. I don't practice as a pharmacist anymore. But when I did, I've noticed that there's a consensus. It's not a one individual issue, but I realized that affordability was always a big problem for any demographic, any race, and it was sort of almost like a universal issue. And considering the fact that we live in the most wealthiest country and most prosperous country, to look at people that are sort of deciding between whether or not to pay for their prescription medications or to cut back on certain meals that they're or food for their family, that really hit a nerve for me personally, because I come from an immigrant household. I know those struggles were real, and to see that happening across every state in every environment, that's really something that hits home.
Yeah. So who do you think is profiting the most from Americans being sick?
Uh, it's very easy to tell that. I mean, if you look at who are the most, I mean, the wealthiest companies, right? We live in a capitalistic society, so you could kind of just look at the wealthiest publicly traded companies. You have CVS Caremark, you have Express Scripts, you have Optum. You have these three conglomerates, huge monopoly companies that have pretty much became top, I think, 20 wealthiest companies in America. And the whole idea behind them of companies like Optum, Express Scripts, CVS Caremark, they have a sort of a subsidiary within them. They're called PBMs, Pharmacy Benefit Managers. And these are sort of these shady middlemen that are supposed to negotiate prices on behalf of patients and drug manufacturers. Ever since their inception in 1960, all that happened to these companies, they've grown in size, they've grown in value, they've pretty much just pocketed all these rebates that were supposed to be passed down to patients and to payers. So if we look at it, you really have to just follow the money and see who's actually profiting the most out of this.
So do pharmaceutical companies actually care about patient outcomes or shareholder outcomes?
So I know that there's this sort of notion that the big pharma is a boogeyman, that they care all about is profit. And yes, partially, they do care about profit because that's how their companies, they're for-profit companies, they have to make money. But I do sympathize with them because they have to spend money into research and development.
That makes sense.
They have to take the risk. They have to perhaps lose a lot of money on failed experiments.
And I'm sure there's a lot of liability there.
Of course. Where I sort of don't have any sympathy for is the sort of the middle layer, these administrative companies that are multi-billion-dollar companies that are paid just to manage drug money. And there's no reason for them to be in the equation. I think healthcare today should be between a doctor, a patient, or a healthcare provider and a patient. There shouldn't be any of these middlemen telling what drug is covered for you or for me, or how the doctor should be prescribing a certain or treating a particular illness. And because of that, it causes this sort of, I guess, internal discongruence or internal struggle where patients' interests don't line up with the interests of the insurance companies, and they're always at each other. Basically, they're against each other.
Mm-hmm.
I think that there should be some sort of an internal congruence where it's the doctor or the provider that's treating the patient and the drug manufacturer who creates a drug for the disease state, all their interests should be aligned. And if all their interests are aligned, there's no need for any middleman that should be telling them how they should be, what drug they should be taking, and which drug they shouldn't be taking.
Do you think that that is the biggest lie in healthcare and what Americans believe, or do you think that there's more to it?
I personally think there's much more to it. I think that we're dealing with this huge behemoth system that doesn't know what's left from right. Everybody, like I said, is looking out for their own direct interests.
Mm-hmm.
And if you're looking at a system as a whole, you really can't control this massive system. So I believe healthcare should be always done on a personal, individualized level,
Mm-hmm.
where it should be only between yourself and the provider.
So what do you think is more broken right now? The healthcare system, insurance, pharmaceutical?
Well, I'm very optimistic about our healthcare system because of the technology, because of AI, because of everything that's sort of coming our way. I think insurance systems are still going to be around just because of their notion that there is risk involved. I think that within the health insurance system, the PBMs are the unspoken culprit that nobody talks about. And have you ever heard of a PBM before?
No.
No. So you see that the problem is that a lot of people have never heard of these PBMs,
Mm-hmm.
and these are these shady middlemen companies that pretty much are the ones that are responsible for dictating the price of a drug, demanding kickbacks from drug manufacturers. So whenever you hear a drug price going up, it's not because the manufacturer is dictating that price. It's these PBMs that pretty much control millions of lives. And in order for a drug to be on the market, the drug manufacturer has to pay a kickback or a rebate to these PBMs in order to allow for that drug to be covered under the insurance plan.
Right.
And because of that, they're getting away with just murder. They're basically stealing billions of dollars that should be passed on to patients and to self-employer groups and to union plans. And they've just pretty much been lining their pockets for decades now.
So now to talk a little bit more about you and your business. You went from pharmacist to founder. What did entrepreneurship teach you about the power that school never taught you?
That's a good question. To go against the grain.
Mm-hmm.
So when I was in school, I went to school for 7 years. I pretty much never went to class. I think I was one of those kids that was just studying in the library,
Yeah.
never attend class.
I was like that too.
I never I don't know why, I never vibed with professors that well.
Mm-hmm.
So for me, it was always going against the grain. And I felt as if entrepreneurship in general is that naturally. It's going against the grain, going against the 99% and doing something that you're sort of told you can't do.
Right. I resonate with that a lot. I mean, like I mentioned, I studied psychology. I also minored in international business. But I feel like everything that I have learned and even all of my setbacks have come from just being out there and doing it myself. There's nothing that like a book in school would teach me. I was never in class, but I was doing all my online classes and I would go to take the test, but I didn't talk to my professors, and I felt like, whatever I'm going to learn in real life is what's going to be most valuable to me.
I didn't want a brown nose either.
What university did you go to?
So I started in CUNY, Queens College.
Okay.
And I transferred over to LIU Brooklyn. It's Long Island University in Brooklyn, where they had the pharmacy school. So I went there attended it for 7 years, got my doctorate in pharmacy, and I didn't want to look back.
Good. Have you ever had a moment where you realize your company has becoming more disruptive enough to threaten traditional systems?
Yes. The moment when we start getting attention from these PBMs, from like companies like CVS Caremark, where they were threatening with arbitration and with lawsuits, we knew that we were onto something.
Of course, because they're threatened by you.
Yeah, and not only were there coming like these sort of threats, there was actually lawsuits coming at us, and thankfully to this day we beat every single one of them. We've sort of they tried freezing our funds. They tried they tried basically doing the most dirtiest things and making sure that our company would sort of fall. And we're not the only company that deals with these PBMs. Every independent pharmacy that that's owned by a mom and pop shop for years pretty much has this sort of almost this beef with these PBMs. And the problem is that it's like a David versus Goliath battle. They have endless funds, they have endless amount of resources, and they use intimidation as a tactic to try to bring you down to your knees. So the idea here is you have to sort of stand up to them, and if you truly believe and you have conviction in what you're doing, then you'll survive.
What separates you and your business? How have you survived in this healthcare system and other businesses and pharmacies that have been crushed by, they're ultimately scared that they're pausing their funds and going into arbitration. So what has separated you from that?
Being innovative. I think that if you're going to be doing what 99% of other businesses are going to be doing, you're going to fail. If you're going to be innovative in your thinking, and actually being in tune with what is really needed. If you see that, let's say, it's not only for pharmacy, I think it applies to any business. You have to have a pulse on the market. You have to know what people want. You have to know where the market's going and sort of stay ahead of that loop. If you're able to stay ahead and sort of predict where the outcome or where the market's going, you'll be very successful.
I think that's the foundation of any successful brand or business. So I agree 100%.
Yeah.
People see success now, but what was the lowest moment building Invictus?
Lowest moment. Lowest moment were I want to say the lonely nights and the 24-hour clocks, times where you just wanted to just throw in the towel and give up, but you kind of were, you're back against the wall, and you have family, you have wife, kids, a lot of people cheering you on and hoping that you would actually set example. So you don't want to let them down. You want to sort of set example for others, sort of pave the way forward. So I think that was a sort of a down, but I converted that into basically a motivating drive.
So you have good support with your family and your wife, and
I think that's the most important thing. If you have support from your family, from your wife, from your spouse, from your loved ones, you could go through any obstacle course in life.
do you think that this is going to be like a legacy that you leave for your kids? I know you said you have 3.
Yeah, I have 2 boys and a girl, and I think that every day I wake up, I only think about them when I do my business. I think that legacy is the utmost important thing for any person to have, to leave behind. And I think that's one thing that I struggled in early in my life, where I used to think to myself, like, oh my God, we're all mortal. We're all here for a very limited amount of time.
Mm-hmm.
How do you overcome that? The only way you could overcome that is by having something that could outlive you. So I think that when whatever you're working on building,
That's beautiful.
that's what you have to build something that could actually outlive your physical presence.
Yeah, I always say that all the time. My kids are only 4, 2, and 1. It's hard to keep track now because there's so many.
It's a fun age.
But I always say that I want I want my kids to see that their mom was, powerful, that was doing something, and I can leave something behind for them. I know they're only boys, so maybe they won't be in my industry, but at least that same ambition and motivation that I had, hopefully I instill that in them. Do you give back to the community with the work that you do?
I think it's important. I think it's necessary, and I also believe that it's good karma. It's also, I'm Jewish, so in my faith, it's like a must to give tzedakah, to give charity back. But I also believe that it should be done at a local level. I think that the best way to give back is especially where you start. So any business that I started, and we have several pharmacies throughout New Jersey, we always try to give back to that local community at that local level, because I think those were the ones that were with us when we just started. They supported us, and I think it's important to sort of give back at that local level. In a way, it's like they believed in you when you were starting up, so this is a way to pay back to that.
So you started when you were 24. How many years has it been now?
Well, I'm 34 now, so
it's been 10 years.
Yeah, it's been a decade in the making.
Okay, yeah, I started when I was 20, so I'm 30.
Nice.
Yeah.
So, where did you start at?
So I'm in the fashion industry, completely different. But I started, I worked in a hospital, local hospital here, and I thought I was going to go the doctor route. I worked in the ER. I was just a medical scribe. And one of my close friends to this day, she's an ER doctor, and she was like,
she's probably miserable.
This industry is not for you. And not because I couldn't handle it, because I think that's what I love about being an entrepreneur is it's almost, I like that fast pace, and every day is different. So I think that's what I appreciate about it. But I just knew that, it wasn't for me. And then I just dove dove right into fashion. My mom is an interior designer, but she also designed jewelry, and she was doing really well. It's a business that she had since 2009. So I just piggybacked off of that, and here I am today. But my dad would still joke all the time that he wanted to see, my maiden name was Boet. I'm French, so he wanted to see Dr. Boet. And even walking into my first big retail store, he was like, I'm really proud of what you've accomplished, because it's not easy. And this is still before COVID, but I was 21, 22 with this, big retail space that I now had to manage. And luckily I also did have that support. I had already met my husband at that time. So, he was just letting me grow and build my own business. And, he handled everything else. And I just had to, put all my eggs in one basket and what I decided on. But like you said earlier, if you are not changing with the market, you will fall behind. And that's where a lot of these businesses struggle, and they don't continue to grow.
Yeah, they become stale, and they sort of just like accept the reality of what it is today, and they're just accepting things as they are. They get very comfortable, and that's one thing I don't like to do.
It's important that you have that understanding from pharmacist to founder, that you could, you went to school for pharmacy, but you have that understanding that you need to move with the changes of the market.
Absolutely. Especially for pharmacists, we're considered to be the most overeducated and underutilized profession out there in healthcare. So
you see, I didn't even know that. That is, but I could see how that's true.
Right, because you assume pharmacists were just pill pushers, but we pretty much have to study. I mean, you have to do the entire undergrad just as medical doctors, and then all this vast knowledge about chemistry and medicine and pharmacology, and you really don't apply it in the retail settings, Right.
So when people hear the name Meyer Davidoff 20 years from now, what do you want it to represent?
Ooh, definitely a defiant brand, a brand that was a pioneer. I think my name, like I try, whatever I do, I always sort of think to myself, I'm putting whatever work I'm putting in, it's into the intangible, into the goodwill, I guess, asset. So whenever anyone hears Meyer Davidoff 20 years from now, I hope they're going to know what the name stands behind.
I love that. It gives purpose. I love that. Beautiful. So, and finally, what does being more than your title or profession mean to you personally?
It means responsibility. It means you have responsibility. Mine's a title. I think you have responsibility to yourself, to your close ones, to your business, to whatever you do. So whatever your title is, I always take, I always feel as if like anything I do, I go into it as an intern, and I make sure that anything I put my mind to it and my effort, I make sure that I know every little dot, every area, every nook and cranny, because I think it's important to be master of your fate and master of your craftsmanship.
I agree. Well, I want to say thank you so much for coming on to the show.
Thank you for having me.
If you want people to find you on social media, your website, let everybody know now where they can find you.
So if you guys need medications, if you guys need affordable medications, and if you need a telehealth visit or you need either or, you can visit us at www.invictuspharmacy.com. Sign up. It's free. You'll get affordable prescription drugs. You'll get complimentary telemedicine calls with providers. And stay tuned, because we're going to be rolling out a lot of interesting things through that website, which are going to be beneficial for you, for your family, and perhaps even for your small business.
Thank you.
Thank you.
So thank you so much for watching. I hope you guys enjoyed it. You can find me on Instagram at Genavieve Paige. You already found out all his information. I hope you enjoyed the show.